Let's just start with details about this variant. What do we know?
Okay, good morning, and good morning to all your viewers. Yeah, so what we know about that this variant. First, it is part of the Omicron family, so it's not a new variant of COVID. That's why it gets this complex naming, NB.1.8.1. Yeah, so it's part of the Omicron family. Yeah, it is identified now as a variant under monitoring. This is the lowest level that we have on the WHO. So, for example, if it become a lot of infections, it will move from variant under investigation and then variant of concern. So it is just that it's a lineage of Omicron that seems to be causing infections, not only in China, but also in Europe, and was peaked like 20 times in the US, very small number of people, which is still Omicron. So at the moment, we do not have lots of reason for concern in South Africa.
Well, apparently in China, it's causing more hospitalizations. Is the variant more admissible, or, can you spread it more than all the other variants that we've experienced?
Okay, so what's happened with respiratory pathogens, not only COVID, but with influenza, with RSV, is that every around 6 months around the globe, you have a wave of infection. And what tends to be that the new lineage strain is slightly more transmissible, but does not mean that will cause more disease. So, for example, I just checked all our data in South Africa, and at the moment we not find this lineage of Omicron in South Africa, and our infections is at very, very low levels, some of the lowest levels that we have seen during the last 5 years. However, we have quite a growing infection of influenza virus. So, and that it started a little bit earlier, our winter wave, and that is in RSV, and this lineage of COVID is the one that's causing some respiratory infections.
Yeah, it obviously is because of winter. You mentioned the US. Has this NB1.8.1 been detected outside of China? Is there a likelihood that it will land here in South Africa?
Yes, it has been detected outside China. So how you detect that? It's similar what we do in South Africa with genomic surveillance. It has been detected in China, in France, in Japan, in Netherlands, in Spain, and South Korea, in the US. But in these countries, they did not see a very fast increase of infections. So that's what viruses do. They travel, and they travel with people in the planes. And at the moment, it's just the one that the scientists and the WHO are monitoring, but it has not scaled the level of interest or concern.
Okay. Prof, if you don't mind, can we just move to another very serious matter? The organization that you direct, CERI, has had 6 NHI grants cancelled this month. How will this impact your operations? Or NIH, excuse me.
Yes, thank you. So it's not only my operations, but at the moment, most of the large medical research programs and surveillance in South Africa are being affected. So for example, in Stellenbosch University alone, over 300 full-time employees are affected with the lack of the US funding. So in my organization, we are busy working with other funders and other supporters, so not to disturb the activities of the organization, because it's very important that surveillance keep advanced fast. In addition to that, we have been also working with companies and industries to create an ecosystem that the scientists, not only in our organization but across the country, have the support to move some of the scientific advance to products and commercial companies, because we need to start being less reliant of international funders and starting producing some of our own diagnostic, therapeutics, and vaccines in South Africa.
Mm-hmm. Yeah, because the work that you do is quite important, Prof. I mean, we've seen you win awards, international awards, on behalf of this country and your significant work. On a positive note, though, you and other colleagues recently launched a state-of-the-art biotech incubator. Can you give us more details about the significance?
Okay, thank you. Yes, so that's a program that we have with University of Stellenbosch. It's based in Stellenbosch, where we refurbish a building, to start hosting startup companies in the biotech sector. So, for example, we just launched that program with support from the MasterCard Foundation and other funders. That is to give the environment that young scientists, when they do scientific discovery in the labs, and that's not only for Stellenbosch University, anyone can participate across the country. They have the space that is set up at very high level, what we call a good lab practice, that can start producing reagents and vaccine and diagnostic that can enter the market. So, for example, now we already have 4 companies that are being incubated this area, and one of them, biotech, is producing enzymes that can be used in the diagnostics and production of vaccine. And that's very important because we import 99.9% of this kind of very expensive reagents, and we need to produce in South Africa to generate income and jobs, but also to make the country more resilient.
Yeah, absolutely. Prof, thank you so much for your time. Thank you for speaking to us this morning. CERI Director, Professor Tulio de Oliveira, speaking to us there. So it's not that bad.
Yeah, it's not that bad.
Don't panic.
It's just
that we have so much trauma from the word COVID-19 that you hear.